Hey everyone, hope you're having a great day. You're listening to the RX Daily Dose. Today's episode is being recorded for Monday, February 14th, and I'm your host, Ian Parnagoni. We update this podcast for healthcare providers, medical professionals, and anyone who has an interest in drug updates. Don't forget to like, share, and subscribe on all your favorite podcast platforms and social media, including iTunes, Spotify, YouTube, and Instagram. All links can be found in the show notes below. So in today's episode, I'm going to do things a little different. I'll talk about first 2 COVID updates, including the EUA expansion of Veklury and approval of Spikevax. And then I'll review updates on new drugs since we last talked. As always, feel free to skip around. I'm going to include times in the show notes so you get the drugs that interest you. First up, the FDA expanded the emergency use authorization for the antiviral drug remdesivir, which goes by brand name Veklury, to include certain non-hospitalized adults and pediatric patients for the treatment of mild to moderate COVID-19 disease. This provides another treatment option to reduce the risk of hospitalization in high-risk patients. Previously, the use of Veklury was limited to patients requiring hospitalization. As a reminder for everyone, Veklury is not a substitute for vaccination in individuals for whom COVID-19 vaccination and a booster dose are recommended. The FDA has approved 2 vaccines and authorized others to prevent COVID-19 and the serious clinical outcomes associated with COVID-19, including hospitalization and death. The FDA urges the public to get vaccinated and receive a booster if eligible. So the FDA has expanded the approved indication for Veklury to include its use in adults and pediatric patients with positive results of direct SARS-CoV-2 viral testing, and who are not hospitalized and have mild to moderate COVID-19 disease. This also includes those patients that are at high risk for progression to severe COVID-19, including hospitalization and death. The agency also revised the emergency use authorization for Veklury to additionally authorize the drug for treatment of pediatric patients weighing 3.5 kilograms to less than 40 kilograms, or pediatric patients less than 12 years of age, weighing at least 3.5 kilograms. Based on these actions from the FDA, these high-risk non-hospitalized patients may receive Veklury via IV infusion for a total of 3 days for the treatment of mild to moderate COVID-19 disease. The approval of Veklury for use in non-hospitalized patients is supported by a randomized, placebo-controlled clinical trial that included 562 non-hospitalized patients with mild to moderate COVID-19 who were at high risk for progression to severe COVID-19, including hospitalization or death. The main outcome measured in the trial was whether a patient was hospitalized for any COVID-19 related reason or died from any reason within 28 days of treatment. Overall, 2 of 279 patients who received Veklury required COVID-19 related hospitalization, compared to 15 of 283 patients who received a placebo. There were no deaths noted in either group. Pediatric patients for whom Veklury is authorized will receive doses adjusted for their body weight in order to achieve comparable exposures to adults and pediatric patients receiving the approved dose. Given the similar course of COVID-19 disease, the authorization of Veklury in certain pediatric patients is based on extrapolation of efficacy from adequate and well-controlled studies in adults. Important details about using Veklury to treat COVID-19 for its approved use is available in the prescribing information, which includes dosing instructions, potential side effects, and drug interactions. Possible side effects include increased liver enzymes, which may be a sign of liver injury, and allergic reactions, which may include changes in blood pressure, heart rate, low blood oxygen level, fever, shortness of breath, wheezing, swelling, the typical things that you'd think about when it comes to allergic reactions. Similarly, safety information about using Veklury to treat COVID-19 in certain non-hospitalized pediatric patients under the EUA is available in the fact sheet for healthcare providers and parents and caregivers. The FDA granted approval and reissued the revised EUA to Gilead Sciences. In other COVID news, the FDA approved a second COVID-19 vaccine. The vaccine has been known as the Moderna COVID-19 vaccine. The approved vaccine will be marketed as Spikevax for the prevention of COVID-19 in individuals 18 years of age and older. Spikevax has the same formulation as the EUA Moderna COVID-19 vaccine and is administered as a primary series of 2 doses 1 month apart. Spikevax can be used interchangeably with the EUA Moderna COVID-19 vaccine to provide the COVID-19 vaccination series. Moderna COVID-19 vaccine remains available under EUA as a 2-dose primary series for individuals 18 years of age and older, as a 3rd primary series dose for individuals 18 years of age and older who have been determined to have certain kinds of immunocompromise, and as a single booster dose for individuals 18 years of age and older at least 5 months after completing a primary series of the vaccine. It is also authorized for use as a mix and match single booster dose for individuals 18 years of age and older following completion of primary vaccination with a different available COVID-19 vaccine. The approval of Spikevax is based on the FDA's evaluation and analysis of follow-up safety and effectiveness data from the ongoing randomized placebo-controlled blinded clinical trial that supported the December 2020 EUA for the Moderna COVID-19 vaccine and information from post-EUA experience to further inform safety and effectiveness. The updated analyses to determine effectiveness of Spikevax included 14,287 vaccine recipients and 14,164 placebo recipients 18 years of age and older who did not have evidence of SARS-CoV-2 infection prior to receiving the first dose. The data used for the analyses were accrued before the Omicron variant emerged. These data demonstrated that Spikevax was 93% effective in preventing COVID-19, with 55 cases of COVID-19 occurring in the vaccine group and 744 COVID-19 cases in the placebo group. The vaccine was also 98% effective in preventing severe disease. The FDA's safety analysis of Spikevax included approximately 15,184 vaccine recipients and 15,162 placebo recipients 18 years of age and older. More than half of these participants were followed for safety outcomes for at least 4 months after the second dose. Approximately 7,500 participants originally assigned to receive Spikevax in the blinded phase of the clinical trial completed safety follow-up for at least 6 months after the second dose. The most commonly reported side effects by clinical trial participants were pain, redness and swelling at the injection site, fatigue, headache, muscle or joint pain, chills, and nausea or vomiting. The FDA granted this application priority review, and the approval was granted to Moderna TX Incorporated. And so here's a quick roundup of some of the other FDA approvals that have happened recently. The FDA approved Deradorixant, which goes by brand name Quviviq, to treat adults with insomnia characterized by difficulties with sleep onset and or sleep maintenance. It is currently pending controlled substance scheduling. The approval was based on efficacy findings in 2 studies in which a total of 1,854 patients from the indicated population were randomized to receive Quviviq or placebo for 3 months. Patients could enter a 9-month extension study following the treatment. At months 1 and 3, Study 1 investigators found a statistically significant improvement in latency to persistent sleep, wake after sleep onset, and self-reported total sleep for the 25 and 50 milligram Quviviq compared with placebo. Study 2 findings showed a statistically significant improvement in wake after sleep onset and self-reported total sleep for 25 milligram Quviviq compared with placebo. Quviviq 10 milligram in Study 2 did not show a significant improvement in any sleep measure. The 10 milligram dose is not approved. The FDA also approved Sanofi's sutimlimab, which goes by brand name Enjaymo, for decreasing the need for hemolysis-related red blood cell transfusion in adults with cold agglutinin disease known as CAD. The autoimmune disease is categorized by hemolysis, which is the destruction of red blood cells. Approval of Enjaymo was based on findings from the open-label single-arm Cardinal trial in which 24 patients with the indicated population received the study drug for up to 6 months, after which they could opt to continue in an extension phase of the trial. In all, at 6 months, 54% of patients responded to the treatment. In addition, 63% of patients showed an increase of greater than 2 grams per deciliter in hemoglobin level. 71% did not receive a red blood cell transfusion after the first 5 weeks of treatment, and 92% needed no therapies for CAD. This biologics license application received orphan drug and breakthrough therapy designations and was granted priority review. The FDA also approved Azurity's new Baclofen suspension, which goes by brand name Fleqsuvy, for treating spasticity related to multiple sclerosis or spinal cord injuries or diseases. Approval of the antispasmodic agent was based on a demonstration of similar bioavailability in a pharmacokinetic study comparing Baclofen oral tablets and Fleqsuvy in healthy adults. And finally, the FDA also approved Genentech's faricimab, which goes by brand name Vabysmo, approved for treating wet age-related macular degeneration, known as AMD, and diabetic macular edema, known as DME in adults. This biospecific antibody targets and inhibits the disease pathways in the respective conditions. Approval of Vabysmo was based on findings from 4 ongoing Phase 3 randomized, multi-center, double-masked studies. Findings across the 4 studies demonstrated that Vabysmo was non-inferior to similar product Eylea. And that's all I have for right now. I hope you enjoyed today's episode. I'll include all links in the show notes below, so please go back and check those out too. Please connect with me on any of your social media platforms and give me feedback on what you heard today. I'd love to know what you thought about the episode. And as always, feel free to like, share, and subscribe wherever you listen to your podcasts. And thank you so much for tuning in. Stay safe out there, and I hope you enjoy the rest of your day.